Very good afternoon to all of you. I want to thank the organizers for inviting me here, especially Dr. Bhatia. There is nothing more important to me than helping people get better and stay that way. That's my passion. And today I got awarded for my passion. So thank you for that. Talking about non-communicable diseases, I'll just tell you the numbers that this world is suffering from. So there are 36 million deaths worldwide because of non-communicable diseases. Non-communicable diseases are categorized by the WHO as in type 2 diabetes, cardiovascular disease, breast cancer, and respiratory conditions, respiratory disease like COPD, asthma. So these are the 4 broad categories of non-communicable diseases in the world. Now, out of all the global deaths, which is 58 million people die annually, 36 million people die because of non-communicable diseases. And these are largely preventable. So that means we can do so much about these 36 million people. Coming to statistics in India, we have 100 million heart patients in this country. 18% of our population is diabetic, 25% is on its way to become diabetic. We have 40% of the people in urban cities suffering from obesity and other lifestyle conditions. And about 27% of these are women, and the balance are men. I'll share a lesson that I learned very early in my practice, way back in 1984. That is when I started my practice, 32 years ago. In those days, when people used to come to me for weight and related problems like blood sugar, blood pressure, etc., I would give them a health promoting program, give them a sensible food plan, a little bit of Ayurveda, and some exercise. And I found that, so they came in only with weight in their mind. People don't understand when they have diabetes or heart disease, because these are silent killers. When you have blood pressure, nobody comes to you to correct blood pressure, though they have it. But what bothers them is the body image, or the obesity, or the weight, or the discomfort in walking. So when I treated them with all these conditions, I found that all their other associated conditions, like high uric acid, acidity, indigestion, things which didn't concern them, but all of these things got automatically sorted out. So it was then that I realized that food in its natural form has tremendous healing properties. And when used correctly, with an understanding of body chemistry and food therapy, it could restore health in a sick person. It was this realization that gave me my purpose in life, which is to help people regain their health and well-being using natural means. I then went about my self-appointed purpose very seriously, and then I wrote a book which I called Healing with Food. So coming back to today's scenario, we have at Health Total, this is exactly what we are doing, treating patients with type 2 diabetes, high cholesterol, dyslipidemia, high blood pressure, morbid obesity, things like that. And we have about, say, 60 centers all over the country, and we have at any given point about 1,000 to 1,500 patients walking in every single day, doing lifestyle modification, doing all the corrections with Ayurveda. We also use homeopathy, all natural means, so that they get rectified and the whole condition is highly reversible and preventable. So we work with children from 7 years of age right up to 70 years of age. Indian obesity and other lifestyle diseases, they have a very high rate of mortality. And these conditions require aggressive treatment. And at Health Total, what we want to do is reduce the burden of chronic disease in this country. Thank you.